Hello and welcome to the Arrivals Podcast. I'm your host, Merelise Wilson, and I've got my friend Karen Robbins with me today. Hi, Karen.
Hi.
Thank you so much for joining me today. I'm so excited to have you.
Thanks for having me. I'm so excited.
Yeah. So I guess we've known each other now for almost 10 years. Yeah, which is wild. Yeah. And we met in a book club, which I feel like it's got to be the longest running book club of all time.
I mean, we have hats.
We have hats. We have merch. All the things. But it was cool because it was a kind of like random group of women, and it was all pre-marriage, pre-babies. Yeah. And we all came together and just vibed and meshed so well.
Yeah, it's still going.
It's still going. Strong. I know, through, I don't even know how many babies at this point.
I know.
A lot of weddings, a lot of babies.
Yeah. You were the first wedding.
I think I was the first wedding.
Yeah. And then it was just like 4 years of constant weddings within the book club.
Yes.
And then all of a sudden it was babies. So
I know.
This just makes a lot of sense for you to be doing this podcast and with the way that our, lives have progressed, like all of our friends being able to do it too. So it's great.
Well, it was at a book club recently where I got the idea for it because whenever one of us has a baby and then we have book club and we always talk about it. It's the first thing when someone comes back to book club for the first time after they've had the baby, they feel like they can, step away for a few hours. The first thing everyone asks is, let's hear the birth story.
Yeah.
And it's just something that, people love to hear. And so it's actually thanks to book club. Now,
birth club.
It can be birth club, book club, wine and cheese club. Yeah. We have yes. So anyway, and
everyone's stories are always so different. So
exactly.
They're always fun to hear.
Yeah. You were someone I thought of immediately when I started this podcast, someone I wanted to speak to about their birth story because you had two really different experiences.
Very different. Yeah.
Very different. And so I'm excited to dive in today.
Yeah. So I have 3 little girls. My oldest, Rebecca, is now 4 years old. And I have twin girls who are almost 2. And so very different birth stories. I guess I can start with Rebecca's.
Yeah, let's start with Rebecca.
Okay. So Rebecca was, from a pregnancy standpoint, just like the easiest pregnancy. I gained a lot of weight, but besides that, it was pretty smooth sailing. She was like one of those babies that was always so active where you could like see her kicking and punching inside of me. And
it's so cool.
Like just constantly looks like a little alien all the time in there.
And so sci-fi. Yeah. It's so weird.
And I think she was just happy to be in utero because she stuck around past 40 weeks and
she did not
want to come out. No. And so I remember like at my 40-week appointment, I said, like, can we go ahead and schedule an induction? Mm-hmm. And if she doesn't come, of course I wanted her to come naturally because I just thought that would be easier. But they said we had to do so we were living in Baltimore at the time. Mm-hmm. And they told us that we had to come in, or that I had to come in every 2 days at that 40-week period, because at the hospital where I was giving birth, they didn't induce before 41 weeks.
Oh, wow. That's so different from almost every practice in Atlanta.
Yes, so different. And when we moved here and I switched back to my old practice here, it was like so funny to hear the difference in opinions.
Yeah.
But so I went in for the fetal non-stress test every 2 days with Rebecca.
I had to do that too.
Yeah. And I remember not knowing really what that was or how the scoring worked or anything. But the first day that I went in, they were like, you passed. And secretly I was like, really? Ugh, I really wish that I had. Like I was just so miserable that last week.
I know. When was she born? What month?
She was born July.
Yeah.
So she was due July 10th.
Okay.
And then the second time I went in for the fetal non-stress test, they said, she didn't score what she needed to score. So we're going to go ahead and induce you.
Okay.
That was on the 16th. So she was born on the 16th. I guess that was on the 15th because, wait, is that right? No, the 16th.
Okay.
Yeah. And so I remember they were like, okay, go ahead and go down to labor and delivery.
Did you have a bag packed or anything?
No, I didn't have my bag packed. My husband was in his fellowship in gastroenterology in Baltimore. And so he was at a different hospital.
Had you guys talked about a plan? Because I'm sure his schedule was really crazy and demanding.
I said to him, I was like, I don't think that they're going to induce me today, but just in case, have your phone on.
Yeah.
And have your phone with you. And so I remember calling him. My mom was actually in town. She came in town the week before because she wanted to be there just in case Rebecca was born early, which clearly she was not.
I know.
We always hanging around for a week.
They tell you not to get attached to due dates. And then it's just so hard not to. And it's so hard. I remember with Kit, we were convinced he was going to come early. I don't know why. There was no reason at all, but I just had it in my head. And then it's even harder if you have a baby who comes late when you think they're going to come early.
Right. But, it was every day I was like, is it today? Is it today?
Yeah.
And I barely had any contractions. But what was interesting was like, even when they were doing the test, they were like, oh, you're having contractions right now. And I had no idea. Like I could barely feel it, if at all. And I was always under the assumption that if you're having contractions, it's going to be like pretty obvious.
Really obvious.
Yeah.
Mm-hmm. Were you dilated or effaced at that point?
I was 70% effaced and like 1 or 2 centimeters dilated.
Okay. So not nothing.
Yeah. Not nothing. But, I just didn't feel like she was going to come that quickly, even though she was like 6 days late.
Right.
But yeah, I called Gordon and I said, come to the hospital, grab my bag, like pack my bag, grab it and bring it to the hospital. And so I was like, I actually have, it's so funny. I told Gordon when he got to the hospital to like start making notes in his phone so that I had them of like what happened. Cause I knew I was never going to remember.
No, it's such a blur.
Too much happening. Yeah. And it was in 2021. So it was like right, after COVID, but I still had to do like the COVID test and we had to wear masks until the tests were clear and
couldn't have anyone else there.
Yeah. No one else was there. I think my mom and dad maybe went back to my house and then like sat in the waiting room for a little bit, I think too.
Yeah.
But yeah, I remember I checked in. I have this on my phone, literally in my notes that Gordon took. I checked in around 2:30.
Okay.
So I like went straight there. I was like shaking and crying because I just wasn't ready. Like it was overwhelming.
As ready as you are to no longer be pregnant, it's still, you're also like, wait, but I'm not ready to give birth. I'm not ready to go home with a baby.
Right.
Like,
and I'm such a type A person that like I needed to know like exactly what was going to happen and when. And clearly when you're giving birth, like you can make only so much of a plan and then like life just happened. So
did they talk to you when they said that they were going to induce you, head over to L&D? Did they talk to you about the induction options or just said like they'll talk to you about it at the hospital?
Yeah. I mean, I knew that I had, of course, like Googled induction and like what could happen and had talked to a couple people. But also I really did trust my doctor. And so I asked her kind of what her idea was. If I were to be induced, what would it look like? And she kind of told me, like walked me through that process. And I had already said, like, I definitely know I'm going to have an epidural. I am just like, I have no pain tolerance my whole life. I like, dropped a can on my foot one time and like went to the ER. That's
that really hurts, to be fair.
It did hurt, but like, I just feel like I'm very much a pain baby. And I was not the kind of person who was like wanting to do a natural birth.
That was not for you.
Yeah. But I checked in at like 2:30 and then they did a Foley bulb and then Pitocin.
Yeah. And so do you want to describe, I don't think a lot of people know what a Foley bulb is. I don't know if it's an Atlanta thing or what, but I don't feel like people get induced with it as much in Atlanta. But do you want to kind of explain what it is?
So it's something that they insert vaginally. It is small when it's inserted. It's literally like a balloon. And as you progress on the Pitocin and you're like dilating, the balloon expands. And as it expands, it's incredibly painful.
Oh, is it?
Yeah, it was pretty painful.
Yeah.
But they basically expand this balloon. And then once you're dilated far enough, it basically falls out of you.
And so the idea is that it kind of puts, well, it's supposed to be gentle pressure, but it sounds like it doesn't feel gentle. Puts gentle pressure on your cervix to dilate and thin out.
Right. Exactly. And it did work really well. I'll say that. But
how long did you have to keep it in for?
Let's see my notes. I had it in for about an hour and a half with Pitocin.
Okay.
And I remember like the nurses saying like, wow, that was fast. Like everyone seemed very happy with the progress I had made, which to be in so much pain, I was like, okay, at least it worked.
Yeah.
Like I was getting some like positive reinforcement that things were moving along. But
it sounds like your body also was receptive. Like it was ready to go.
Oh yeah. Yeah. And it's funny because like even before my mom was like, this won't take long because like she's 6 days late. You'll be fine. And my mom had also had some pretty like easy births with me and my brother. So she thought that like I would kind of follow along that.
Yeah. That's kind of an old wives' tale that you'll have the same birth as your mom. Yeah. Mine was very different personally from my mom, but
I mean, of course I believed her because I was like, that sounds great. I want an easy one.
But manifest it for yourself.
Yeah, exactly. But I do remember also when they were giving me the Pitocin and then I had the Foley bulb in, I kept saying to Gordon, I was like, I need drugs. Like I need something because this hurts so bad. I was crying. I was like throwing up.
Oh gosh.
Yeah. And they did give me something, and I don't remember what it was, but like some sort of pain medicine.
Yeah.
Which was weird because it didn't really like make me have less pain. It was like I just cared about it less.
Was it fentanyl?
I don't remember.
That's kind of what fentanyl does. It doesn't take away the pain, but it just makes you a little out of it. Yeah, some opiate. Yeah.
But that was at least like some relief.
Yeah.
But
were you having contractions? Was some of the pain from the contractions?
Yeah.
Okay.
I think most of it was from the contractions.
Okay. And Pitocin contractions are more painful because it's an artificial contraction. So it's stronger. It's like more intense. Yeah.
Which everyone had told me, like, if you're getting induced and you have Pitocin, it's going to hurt really bad.
Yeah.
And I just thought to myself, like, I can handle it for a little bit until hopefully like I can get an epidural.
Yeah.
And every time a nurse would come in, I would say, can I get the epidural now? And like, Gordon was like, they're going to think you're drug seeking. You keep asking. But
they're used to it. I'm
I know. They like laughed at me and they're like, they're not, your contractions aren't close enough yet. Or they're not, you know. And then finally, once the Foley bulb was out, I think I had the epidural around like 7:20 p.m. So, or so says my notes. I guess I had the Pitocin for like an hour and a half, and the Foley bulb was for an hour and a half, and then the Pitocin a little bit longer than that.
Okay. And how dilated were you once it came out?
4 centimeters.
Okay, so made some progress.
Yes. And then in my notes I have, Gordon got 10 wings from the cafeteria at 8:50 p.m. and fed Karen sugar-free strawberry jello. So clearly amazing. I was feeling better after the epidural. And I remember like from then on out, like feeling like I was just like flying. Like it was great. I knew the baby was coming soon. Yeah. Like they gave me the peanut like ball.
Yep. Mm-hmm.
And I had that between my legs from like 7:20 until Rebecca was born, basically.
How was your epidural? could you feel nothing? Could you feel a little bit? Like what was the epidural experience like for you? Sounds like it was great.
Yeah. I was going to say, I think I had like a pretty ideal epidural experience because I didn't feel anything, but I could feel enough pressure that I knew when my contractions were happening.
Okay.
And so I was kind of like watching the monitor, feeling the pressure, and then like mentally making a note like, oh, that was a contraction. Good. I can feel it. And so I remember when the nurse came in, she was like, how are you doing? And I said, like, I'm feeling pressure down there. Cause she had said to me, like, if you start to feel pressure, that's probably like crowning.
Right.
And I was just hanging out in the room, like, you know, living my best
just
life.
Sitting in the bed.
Yeah.
Yeah.
And kind of had already forgotten about how miserable the like 4 hours were before it.
Yep.
And she said that there was like blood in the catheter, which usually means that, what did she say? Like that you're fully dilated.
Okay.
I don't know like how that works, but then the doctor came in and she had been in a C-section before. So it took like 20 or 25 minutes for her to come in. And I'd like been ready, just sitting there waiting to push.
Okay.
But they like moved.
Wild.
Yeah. They like moved the bed around and lifted me up a little bit. I was like in position, just waiting for her.
What time was this at?
This was at like midnight.
Okay. So you've been there for about 8 hours, a little less than 8 hours. Okay. Yeah. It's pretty
like
short.
I know everyone said it was pretty quick. And I only pushed for like 20 minutes.
So the doctor came in and was like, all right, ready.
She's like, you're ready. I see your head.
Were you like, okay, yes, it's go time?
Yeah. And then it was like fun.
Yeah.
I said it was actually like energizing giving birth with Rebecca because it was easy to a point, obviously. Yeah. But I did ask for a friend of mine had told me like, you have to get the mirror.
Oh yeah. Yeah.
And so I was like, okay, I'll do that.
Did you find it helpful?
I loved it.
Yeah.
And I tell everyone to get in. Of course, some people are like, no, I don't want to see. Yeah. But I loved having it because I felt like when I was pushing, I could see the progress that was being made. Yeah. And like, I could see her. And
I think it's so cool.
It was so cool.
Like if I could have had a professional film crew filming my births, I would totally have. Yeah. So yes, I think even being able to see like a little bit of what is happening while it's happening is so cool.
Yeah. And it's just like fascinating. And I do think that helps you like connect with what's happening.
Yes, for sure. Especially if you have an epidural. What was Gordon? I'm curious, like having a husband in the medical field, like did he do an L&D rotation?
Yes.
Like, okay.
Yeah, he delivered a couple babies in med school.
Yeah.
But
what was he like supportive wise?
Oh yeah, he was great. What was funny was like before we went into the delivery room, I said like as soon as I knew I was getting induced, I was like, you need to let them know you're a doctor because I'm like, you need to play that card so they know that you understand what's happening.
Right.
He's always so weird about it because he doesn't want them to feel pressure if he's there and they know he's a doctor. And so I remember when the anesthesiologist came in and he was like, I'm going to do your epidural. I was like, you better say something because he needs to know. And so they started kind of like schmoozing and they knew some of the same people. And so I was glad that they knew that he was a doctor too. Yeah. But he was really good at advocating for me and like explaining things to me if I didn't know. But I've grown up around medicine, so like I knew a lot of it, but he was just like a great partner and then nice that he had the medical knowledge, of course.
And not squeamish, I'm sure.
Like, no.
So where was he while you were pushing? Was he over by your head or?
No, he was watching. He watched part of it and then was like by my head, kind of both.
Yeah. Yeah.
But I would like ask him, does everything look okay? Yeah. And he would kind of tell me what was happening if I couldn't tell in the mirror or something. But yeah. And then he knew my OB pretty well too because he'd been to most of the appointments with me. So we all were just kind of like chatting the whole time.
That's awesome.
It was a good experience. And one of the funny things was like the doctor said that Rebecca was like shaking her head back and forth, like trying to get out.
Oh my gosh.
And she's like, she's helping us here. Yeah. And I always tell her that story that like she was ready.
She was ready.
At that point. Yeah.
I feel like, and I truly feel like so many babies entered this world with their personalities like fully formed. Yes. And that's just Rebecca's personality.
Oh, totally.
It's like, crazy. Yeah. Like even what you were saying with like the way she was so active in your tummy, like when I picture her just like constantly always dancing moving. And wiggling and moving and like doing all these things.
Totally.
So you didn't push for long.
So pushed for like 20 minutes and then she was born and everything was great. I did like after an hour when they were moving me from that delivery room to the post or the post delivery area, they were moving me from the bed to a wheelchair and I like totally fainted.
Oh gosh.
Yeah. So that was a little scary. I like they were moving, like I took 2 steps into the wheelchair and then Gordon said I turned like wider than he's ever seen me. And I just like fainted in the chair.
Oh man.
So like not on the floor, but
that's good.
The chair. And then they like put me back in the bed and we're like, we can't move you yet. We need to do some tests to make sure that like you haven't lost a lot of blood or, they took a couple of like, I think I got a CBC and something else, but I was fine. So we don't really know.
Maybe a little blood pressure drop or something.
Yeah. Probably some weird like vasovagal thing. But
you'd been sitting for a while. Yeah. Maybe it was just like a.
Yeah. I don't know. But besides that, everything was
very undramatic besides that one little bit.
Yeah. I forget that even happened.
And so after she was born, did you do like a golden hour or anything? Or like, did Gordon cut the cord?
Yeah. Gordon cut the cord.
Okay.
And then I just like laid with her on me for probably 2 hours or whatever it was. Yeah.
It's the best. And so delicious.
It was so sweet. And then my parents came in. Gordon's parents came in.
Oh, they let them come in?
They did.
Oh, that's amazing. Yeah. It's so interesting to hear how the different like cities and hospitals are different. Like because I gave birth with Kit just a month before you. And so we were like right there experiencing it at the same time, but it was so different in Atlanta. Like no one was coming in. Chris couldn't come to my appointments with me. Yeah. Like leading up to it at all. Couldn't come to a single one. So that's really interesting how it's different policies per, but I'm glad they got to come in.
Yeah, me too. No, it was really sweet.
Oh,
so sweet. The first grandkid.
Yeah, that's a big deal.
On my side, on my parents' side.
Yeah, that's awesome.
I think that was everything for Rebecca. So I'm like, overall, it was just like super great.
Yeah.
And I remember just afterwards telling everyone like, it was amazing. I could have 15 children. And like, I just had this like perception of birth being so amazing, which it is.
It is. It's amazing. It's hard, but it's amazing. And that's what's so cool though, is that every experience is different. Yeah. Did you have any, like, how was your recovery physically postpartum? Did you have any tears or?
I think they told me like 2nd degree tear.
Okay.
So it honestly wasn't so bad.
Yeah.
After having the C-section with the twins, I'm like, the recovery with Rebecca and a singleton is like so much easier vaginally and everything. But it probably took like, 2 weeks to feel back to normal completely. Yeah. Yeah.
Oh, that sounds pretty ideal.
Yeah.
For first birth, especially.
It was a good one.
Yeah. Well, I guess we can pivot over to number 2 and 3.
Okay. On to the twinsies. Let's see. So it was a very long pregnancy. I felt like it was just like totally different, of course, than Rebecca. Yeah. I found out at my 8-week appointment that it was twins. And I remember like I was so sick. And I kept saying to Gordon, it's either a boy or it's twins.
Because it felt so different from your first.
So, even though I was sick with Rebecca, it was like a whole nother level of sickness.
Well, when you're carrying multiples, do you have double the amount of, what's the hormone that makes you sick?
Yeah. HCL?
HCG. So you have double the amount of everything.
Yes.
So that's probably.
Oh yeah. Like, I mean, heightened all of the things were, I was just so sick. And I had always like weirdly thought that I was going to have twins.
Yeah.
And my mom had said it to me growing up, like, I wonder if you're going to have twins. And I have very wide hips. So I'm like, if someone's going to have twins, I could carry them,
Yeah.
you know?
But you've no history of twins in your family.
My great grandmother had twins that didn't make it in like 1912. So it was, you know, obviously a very, very high risk back then. And
Right.
I'd always been told like she had twins, but they were stillborn, and no one else since then though. And the generation since then had twins. So I don't know if mine is totally sporadic, but they do say that like fraternal twins runs on the mother's side.
Okay. I have heard that too. Yeah. Do you want to share your theory about how you got pregnant with twins?
Sure.
You don't have to. If
sure.
You want
how
to.
do you remember this? You have such a great
I love this stuff.
So I got off birth control, and I had always been very regular. And for some reason, I started checking like ovulation strips.
Yeah.
And for some reason, I didn't ovulate 1 month, but I still got my period.
Okay.
And then that following month is when I conceived.
Mm-hmm.
And so my theory and things that I've read say that if you hyperovulate, which is what can happen in the female side of the family with history of fraternal twins, if you hyperovulate and drop 2 eggs, it can often happen where you like don't ovulate 1 month and then the next month you drop 2 eggs.
Yeah, so you think that's what happened?
That is my theory. Whether or not that is true, I will never know. But
was it pretty soon after you got off birth control?
Yeah, like right after.
I've also heard that too. Is like sometimes when your cycle is a little bit screwy after you've gotten off hormonal birth control, you can be more likely to like not ovulate 1 month and then ovulate the next too.
Right, which obviously makes sense.
Yeah.
But yeah, I think that's what happened. And when we went into the 8-week appointment, they were doing the ultrasound, and she's looking at this, like, you know, the one sac and the baby, and telling us about it, getting the heart rate. Yeah. And I said, is that another sac? And like, I saw it first.
Oh my gosh.
And Gordon was like, what? And the sonographer like went over and said, yep, sure is. I was like, is there a baby in there? Like, cause you know, at first I was like, I couldn't tell. I just saw the like outside of the sac. And she's like, sure is. And then so she checks the heart rate of that one, like moved over to the other baby. Oh my God. And was like, all right, 2 strong heartbeats. And Gordon, I have never seen him like, he was as ghostly pale as I was probably when I fainted in that chair. But he was like so pale. When he gets nervous, he like shakes his leg.
Oh,
his leg was going like 90 miles a minute. But yeah, I was like, I knew it. And,
oh my gosh, you really did.
Yeah. And we left there, and I like couldn't keep it in. I had to call my mom immediately.
Yeah.
And she's like, well, how's the baby? And I said, they're good. And she was like, what?
Come again?
It's twins. And she knew immediately too, because we've been talking about the theory that we had that maybe it was twins.
Well, I remember, it's funny you say that, because you were living in Baltimore still at that time, and you were looking for houses in Atlanta. And so like every once in a while I'd text you like a house that I saw, or we were talking about something related to real estate, and you were like, well, it's going to need to be bigger than that, because don't tell anyone, but I'm having twins. And I was like, what? I don't think you were like, I think you were so early. And I was like, oh my God.
It threw a huge wrench in things, because like, in addition to obviously like, oh my gosh, it's twins, it was like we were moving to Atlanta, and I was trying to figure out, you know, what kind of house we were going to be looking at. And it was wild. The other funny thing that I've now figured out, because now that I have twins, people do this to me, but like as soon as you find out you're having twins, you reach out to every twin mom you know, even if they're like acquaintances that you haven't spoken to in 2 years. Yeah. You don't tell your best friends. You call these random people and say like, please, like, talk me off a ledge. Like, what's this going to look like? Like, how is this going to work? And it's so funny, because I had like 3 or 4 twin moms that I reached out to at the time, and all of them were like, it's amazing. It's very, very hard. Yeah. Like, it gets easier as they get older, but like, just, you're in for it. Yeah. And no one wants to sugarcoat it.
Yeah. So, I feel like that's helpful. Yeah. But it's also nice to know, like, to see people on the other side. I felt that way just about a singleton with newborn life. Like it was just nice to know that there is like, light at the end of the tunnel, because when you're in it, it feels so hard and so heavy.
Yeah.
And I truly cannot imagine having twin newborn like infants.
I can't. It was wild. But even just like the getting over the shock part was like, I honestly wasn't as shocked as Gordon was.
It sounds like you really just knew.
Yeah.
You like
I had a weird feeling.
Yeah.
Yeah. But Gordon was super shocked. He like called his brother immediately.
Yeah.
Like, listen to this. I have to tell you.
Of course. At what point do you feel like, and maybe the answer is never, but at what point do you feel like it kind of settled in and you started to get like excited?
I was excited, honestly, early on.
Right off the bat.
I think it was just like the logistics piece, like realizing like, okay, we're moving. I'm going to be 24 weeks pregnant when we move. And like, obviously with twins, it's always high risk with multiples.
Right.
And so I didn't really want to tell people for a long time.
Yeah.
Like with Rebecca, I know we told people around 12 weeks. And with the twins, I waited a lot longer.
Yeah.
And I didn't even tell like work or I didn't post anything publicly until like 3 weeks before they were born.
Yeah. Oh, wow. Yeah. Really? Oh, man.
So I was just nervous the whole time. And
understandable.
You're always like nervous every appointment you go to with any baby. But like with twins, it was every appointment I went to was like, thank God everything's good.
And what was pregnancy like with twins?
Crazy. I mean, like I was so sick, and I think I stopped being like nauseous around 26, 27 weeks. Like it took
that's
a very
all?
long time. Yeah, and I was on Vengesta the whole time, so like I
gosh.
had nausea medicine, but also I just like was so big, and I gained so much weight with them, and was like hobbling everywhere. But I had Rebecca, so it was like I couldn't stop moving and doing. So
we forgot to mention also Rebecca's not even 2.
Oh yeah,
right. That's the other thing is you hear about 2 under 2, but you had 3 under 2.
Yeah. So she was a handful the whole time, but honestly that kept me occupied during the pregnancy, so that I wasn't all in my head about like how I was feeling.
I do remember like Karen is a very slender person, and she just had this
massive
ginormous belly. I mean, it looked fake.
Yeah.
It looked fake. No, it was crazy.
And it like stuck straight out.
Yeah.
Like looking back at pictures, it's kind of crazy because it didn't look that much different than my stomach with Rebecca.
Yeah.
So like having 2 in there, I don't know how, but it was kind of similar. I think that the only difference was like it went further out.
Yeah.
It just like was the same
shape. Yeah. I mean, you were a really cute pregnant person.
Oh, well, thanks.
I'm sure you didn't feel
glad I don't have to do that again with 2 and a huge belly, but it was fun.
Oh.
Yeah. I moved when we moved here, like the other thing was like I had to change back to my doctor who I had been seeing in Atlanta, who I love. Shout out to Dr. Combs.
What practice does she with?
She's at Piedmont OBGYN.
Okay.
She's incredible.
I've heard great things about that practice.
Yeah. They're all amazing. And she was my doctor before we moved. And so I knew I wanted to get back in with her. And so I called her when we were still in Baltimore, and right when we found out it was twins, and I knew we were moving back to Atlanta, I called her and was like, can I be your patient again? Like, can you get me on the schedule? I'm having twins. And she was, of course, like, absolutely. And so when we moved here, I had an appointment with her like the first week we moved back, and she was so reassuring. And then she did have me like going to the, the high risk, like specialist. And so I would go every other week or something like that to them. And so they were measuring the baby's growth the whole time. And we had a C-section. Well, I guess it was just induction date. I don't remember. At 38 weeks, it was set. And Annie, so my twins are Annie and Caroline. And Annie was like always breached the whole pregnancy. Yeah. And I knew if we were getting past 30 weeks, like there was no way that she was going to turn at that point. There was no room for her to turn.
There's not a lot of room.
Yeah.
When you first found out you're pregnant, like were you open to the idea of giving birth vaginally to twins?
Yeah. Yeah, I was. From the beginning, I was just like, whatever the safest way is to get them out is what I'll do.
Right.
And I had such a good vaginal birth with Rebecca. I was like, hopefully if I do have a vaginal birth with the twins, it will be okay. Yeah. But I was also very okay with having a C-section if I needed to. Mm-hmm. And so when Annie never flipped, I was like, okay, clearly this is going to be a C-section. Yeah. And I was going in for the scans every 2 weeks just to make sure everything was good. And I think at 36 weeks, they measured and said that Annie, who was always twin A, so there was, A and B, and she was A, she had not grown a lot since the past scan, which was a week before. And so they were like, we're going to go ahead and like schedule the induction or schedule the C-section. And this was on like October 30th. So
Okay.
it was like the day before
Yeah.
Halloween. And they said, we can schedule it for November 1st because that's
Halloween
when,
with Rebecca and
yeah,
everything.
so that I could do like Halloween with Rebecca.
Yeah.
And then I was like, no, my dad's birthday is November 1st. I don't want the twins to have the same birthday as my dad.
Oh, really?
And so, yeah, I like felt bad. And so
I bet he would have loved it.
Yeah, obviously, like thinking back, he probably would have been fine with it. But like, I wanted him to have his special day. And so November 2nd was when I had the C-section scheduled for.
So obviously all their other vitals were good. It was just that growth.
Yeah.
So they felt comfortable letting you go a couple more days.
Right. They said if anything else was going on, they would have like gone ahead and scheduled it. But since I was fine, they scheduled it for the 2nd. I hobbled around that Halloween in a cow costume.
That's right. I remember
with
that.
udders. I was like, this is just
you couldn't miss the opportunity.
Yeah, I had to do it.
Yeah.
But that was fun. And then I couldn't walk the next day. Like I remember we live on a street with like a big hill, and I walked almost the whole way trick-or-treating with Rebecca. Oh my gosh. And the next day I could not get out of bed.
No kidding.
And I like had to call my mother-in-law and like ask her to take Rebecca to school the next day. Oh my gosh. Because I couldn't move.
Wow.
So that's when I was like, okay, it's time. We gotta get these babies out. Yeah. And so on the second.
So you were 38 weeks. Okay.
Yeah. 36 weeks.
36. Okay.
They were born 36 weeks and 4 days.
That's great. 36 is like the goal with twins, right?
Well, anything past 36. They really want you to get to 38, but I think it's 34 is when it's like the safe. It's either 34 or 36. Okay. It's safe.
The viable.
Yeah. And so the C-section was scheduled for like 6:30 a.m. or it was something like whatever the first slot was in the morning. And Gordon and I packed everything up and got to the hospital. And it was funny because like we went in some weird back way to Piedmont that we definitely were not supposed to go in. But like I never sat in a waiting room, and I just like went in some sketchy door. Yeah.
Interesting.
And we signed in. They put us in a room, like, got everything prepared. What I was not prepared for was like TMI, but like they shave you and stuff.
Oh, really?
Yeah,
interesting.
I didn't know that was going to happen.
Yeah, I didn't know they still did that.
Yeah.
Well, that's interesting. I mean, again, not to get too graphic, but like nothing's coming out of there.
Yeah, I guess it was like just to like be able to see where the incision was going to go. I don't know.
Yeah.
But then they put me in the OR, and another thing I wasn't prepared for is that like Gordon couldn't be in there for the epidural.
Oh, really?
Because it's a sterile room, and they only want him to come in like during the birth. And so I will say, like, getting the epidural without like a significant other there was a little scary.
That's tough. Yeah.
But
especially when you also know it's not just an epidural and then you're going to like, go back to hanging out. It's an epidural leading into like surgery.
Yeah, exactly.
Yeah.
But they did the epidural, and it really was no big deal. And then they laid me down.
I assume an epidural with a C-section is a lot stronger. Like with your, like you couldn't feel anything at all. Yeah.
Yeah. And it's different because obviously when it's an epidural and you're giving vaginal birth, I think it's wherever they put it in your spine, it's like higher up or something.
Okay. Got it.
So that it numbs like more of your body. And so then they just kind of like start poking at you a little bit, and they try and find out, we're trying to make sure that you can't feel anything. Yeah. And then I was like, I don't feel anything. And they started the surgery.
Did you have like what was the setup? Like, did you have a curtain? Could you see anything? Like,
couldn't see anything. They have the tarp up, so that you can't see what's happening.
And Gordon's up by your head.
Gordon was by my head. The anesthesiologist was by my head.
Did you have music playing or anything? Or
I don't even remember. I feel like there was music in the OR. Yeah, there definitely was, but like nothing that
you didn't choose it.
Yeah. They might have asked me what. Actually, you know what? I'll have to ask Gordon this, but maybe it was like Taylor Swift. They might have asked me, and then I'm sure that's what I would have requested. But clearly I wasn't thinking about the music so much.
Yeah.
And then Dr. Combs came in, and she had like a second doctor with her who was also amazing, Dr. Garrett. And the only thing like during the actual C-section that was alarming was at some point they said, "Oh, there's blood on the floor." And I was like, "What?" And I looked at Gordon. I was like, "What? And he goes, "Oh no, the tarp just like, I guess whatever happened, like the sterile tarp kind of like spilled." And, but just hearing them say like that my blood was on the floor, I was like, that was like a little bit of a weird panic moment.
Yeah. Yeah.
But they did the incision. First, I remember Dr. Combs said, the baby that comes out first is just going to be the first baby that we grab. Yeah. So like, it might be baby A, it could be baby B. Yeah. Like, we'll just see who it is. And it ended up being A. It was Annie. They grabbed her feet first because she was breached. Yeah. She came out, she weighed 5 pounds, 3 ounces.
Oh, that's big.
Yeah. She had a great APGAR score. So that's like amazing. No NICU for either of the babies, which was
Did
great.
they show her to you above the,
Oh, yeah.
So they like
pull
hold
her
her
out.
up.
Yeah. And then Gordon got to cut the cord.
Oh.
And then they showed her to me, and then they wrapped her up and like brought her up to me.
Oh. Do you have your arms pinned down?
No, my arms they were out. Like they put them by your side, and then you have your IVs in.
Okay.
So you really can't, I don't know why. I couldn't move my arms. I feel like they just put her next to my face, and I didn't really get to like hold her at the time. Mm-hmm. And then they quickly went on to Caroline. And so they took her out. She weighed 6 pounds, 8 ounces. So
wow. Oh my gosh.
I know. Like I had a lot of baby in there.
Wow. You really did.
Yeah. And then they brought her, did the same thing, like showed her to me. Yeah. Gordon cut the cord. They brought her to me. And then the part, like the sewing backup, I feel like definitely took longer.
Yeah.
Than the actual incision and getting them out.
Yeah.
And you could feel pressure, it's like, you don't feel anything but the pressure.
I've heard like tugging. You can kind of feel some tugging.
Yes, you definitely felt the tugging. And then, it's a weird sensation. And like not being able to see what's happening. Of course, I didn't want to see what was happening. So that was fine.
Did she talk you through like what she was doing, or was it just like chit chat? Yeah.
The only thing she talked through was like when she was making the first incision, I think.
Yeah.
But I had made the mistake of watching a video on YouTube beforehand. Yeah. And I would tell everyone who's like possibly having C-section, don't do it.
Yeah.
Because it is like, it's like primal. Like I was not expecting it to be the way that it is. And, I felt fine. Like the whole surgery, even like right post-op, I felt great because I still had like my epidural in me and I had some pain meds in me. They wheeled me back to like the post-op room, and when they wheeled me back, Gordon was holding both girls.
Oh my goodness.
Sitting down and holding both girls. It was like the best feeling and the best sight. I was like crying.
Did you? I was going to say, did your heart just explode? Oh, yeah. Like it's making me teary just picturing it. Oh,
I have a picture of it too. Like the nurse took it. It was
so cute. Was it surreal? We were like, those are both of my babies. I'm like,
he's holding them both, and I go, who's who? Like, I didn't know who was who at the time. And they put their like A and B on their hats.
So I was going to say, like,
see that. Yeah.
Because I mean, I'm sure part of it is instinctual, but like, I feel like it'd be hard with twins at first to like remember exactly who's who.
Yeah. And like, luckily they obviously, Annie was 5'3" and Caroline was 6'8". So like from a weight perspective, it was easy to know who was who. And then once I saw their little faces, I was like, okay, it's pretty clear that you can tell who's who. But then I got to hold them when I was like laying down in the post-op room. And I think I nursed then too, but then I threw up. It was
oh gosh.
Yeah.
Was it like a symptom of the drugs?
Yeah.
Or, yeah.
And I was not expecting that. They didn't tell me that was possibly going to happen. But then again, afterwards, when I talked to other C-section moms, they're like, a lot of people throw up.
Yeah.
So there's the first picture of me holding both of them. I have like a throw up bag next to me.
That's just like, motherhood, isn't it? Like, beautiful and gross all at the same time.
All at the same time. Like I love that picture still because it like reminds me of, how funny that moment was. That was like, I was feeling great for that whole first day probably. And I remember telling like Gordon and even friends that I was talking to, like, C-sections are great.
Yeah.
It's so easy.
Yeah.
I feel wonderful. And then the next day I was like biting my tongue.
Yeah.
This is awful. The recovery was so rough for me. I was in so much pain. I could not stand up. I couldn't get to the bathroom. It was like awful.
Just night and day.
Yes.
Wow. Did you get up that first day?
I don't know. I don't even think I tried that. Yeah. Oh, because the epidural and everything, I really like the drugs didn't wear off enough that I could even try. But then the next day is when I tried, and it was so bad. And I was in so much pain. And I was doing the like whatever, the ibuprofen around the clock, and they gave me like oxycodone or whatever.
Yeah.
And it still was like not helping.
Oh gosh.
But I ended up having to get a blood transfusion.
Oh my gosh.
While I was there, because I had lost a lot of blood, which now makes sense with the blood falling on the floor. I was like, okay, clearly there was a lot of blood. And so I did. So first they gave me iron because I really did not want a transfusion.
Yeah. Why did you not want a transfusion?
Mostly because I didn't know enough about it.
Yeah.
Honestly. And then every time when I was talking to Gordon about it, he's like, they're really, really safe. Like it's very clean. You don't have any, you don't need to have any fears about it.
There's extensive testing of the blood.
And he made me feel good about it.
Yeah.
But at first I was like on the cusp of needing the transfusion. And so I was like, if I can get over it with just iron, like I remember I ate like a steak or a hamburger or something that night, trying to not have to get the transfusion. And then the next day, there's pictures of me from those days, and I am like as white as like an alabaster wall, like so pale.
Oh,
and they were like, you're going to have this transfusion, because I also didn't even have the energy to like sit up. I would get really dizzy.
Right. let alone I'm sure like nurse or like, yeah.
And I was still nursing at like trying to nurse at the time just because I probably didn't have any, it was colostrum or whatever.
Still, yeah.
Yeah. I ended up having the transfusion. I was in the hospital for I think an extra day. So maybe it's like 3 or 4 days with a C-section and then I was there one more day.
Okay.
But yeah, after that, they discharged me and I remember thinking like, I am not going to be able to do anything.
Yeah.
So I was still like pretty much in bed for like several days.
Wow.
Where they would just like everyone would bring me the baby and or the babies. And I remember walking into the house, coming back from the hospital, and I didn't want Rebecca to like see me looking or feeling bad. And I was walking like hunched over.
Yeah.
And so I asked my mom if she could like take Rebecca outside to the backyard while I came inside and sat down.
Right.
And so then Rebecca came in and like didn't know how bad I felt, but it was
that's
hard.
Brutal.
Yeah.
I mean,
C-sections are no joke.
A C-section by itself is no joke. Yeah. Twins by themselves are no joke. I can't imagine the combination too. Like you put them together and that you've got 3 kids under 2. You've got you're recovering from a C-section. At what point did you start to feel somewhat good again?
Like maybe 2 or 3 weeks after.
Wow.
Yeah.
Oh,
we had a lot of help. Like I had my amazing nanny, Linda, who I could never have done it without her.
Yeah.
She was incredible. My parents were there. We had a night nurse. So it was like when Linda left my house, the night nurse came to my house. So it was like around the clock help.
Yeah.
Again, it's like if I couldn't have done it. Like with the surgery and everything, there was no way.
No.
Without help. So I'm so grateful to like all of our family and all of our help that we've had.
And I'm sure Gordon like didn't get much of a paternity leave.
5 days.
Yeah, exactly.
Yeah. And I mean, of course he was so helpful when he was there, but
but he had to get back to work.
Yeah.
Wow.
Yeah. Man. It's just wild. And I remember I had my like little cart with all my medicines on it and my timer set for trying to like keep up with everything. But it's funny because like even going like after having both births, I can understand like wanting one versus the other, but everyone's are so different because I've talked to people who've had C-sections that had an amazing experience, like no issues, would do it over and over again.
Yeah.
And then there's me where I'm like vaginal all the way. That was so much
easier for you.
Yeah.
Do you think it had anything to do with just also the recovery that your body was going through having carried twins?
For sure.
Yeah.
Because afterwards I had talked to my OB and she's like, everyone who has multiples, the C-sections are always a lot tougher.
Really?
Yeah.
Interesting.
Yeah.
I mean, your body went through a lot.
Yes. No, it's like, it is just no joke. I mean, that surgery is like, especially for someone who's never had a surgery, it's like, you go into this, I mean, it's wild. It's like, it's really something.
I mean, I assume it's helpful that like you said right off the bat, like the most important thing to you was obviously getting the babies here safely.
Yes.
So I'm sure it's helpful to be able to focus on that in those times.
Yeah.
But man.
Yeah. Like reliving it. I'm like, woo. The shop is closed.
Yeah. You're like, nope, I'm good.
Yeah.
I'm good. Yeah. Now you have 3 beautiful girls. The twins just turned 2?
Yes. Or they're turning 2 November 2nd.
Oh my goodness. That's wild. It has flown by.
I know. It's really like, it feels like the last 2 years were just like a blip in time. Like, I don't know how. It has gone so fast. Yeah.
I'm sure. You're just kind of you're in go mode.
Yeah.
Twins are not. When your babies are that little, like you just kind of go.
Yes.
And then you like look up and they're turning 2.
I know. It's just wild. Like now Annie is like trying to put herself in the car, like wants to climb in. And I'm like, this is making my life a lot easier. Like just like the simple things that now they can do.
Yeah.
But also they're also like climbing on all the furniture and trying to jump on the chairs right now. So, just wild.
Have you gotten the chance to kind of repay the favor with any twin moms?
Oh yeah.
Yeah.
Oh yeah.
Is there a network that like twin moms should know about?
Well, it's funny because when I moved here, my sister-in-law's mother's friend's daughter was also having twins at the same time and also had a child the same age as Rebecca.
Okay.
And so she put me in touch with her and then her name is Amanda. And then Amanda started like a group chat of all these twin moms, these moms that were having twins in the next 4 months.
Yeah.
And we still are on a chat together. We talk all the time. We have a dinner, like we just started having dinners like once every couple of months.
Yeah.
And I'm actually hosting them at my house next. So we have, it's nice to have the moms whose children are all around the same age too. Cause then you can like commiserate on things that are happening. And the twin moms really understand, they can understand everything, especially if it's like twin moms who have an older kid.
Yeah. That's
and
special.
then also like I mentioned, there are several moms who had twins after me that reached out, and I do whatever I can to give them any sort of advice, whether it's like strollers or how to get all the kids in the car.
Yeah.
And if you're looking for a new car, like I had to do,
right.
you know,
go from 1 to 3.
Yeah.
You need a bigger car.
Yeah.
You're going to need a
3
bigger
car
boat.
Seats. Yeah.
Oh man.
Yeah. So if you're a twin mom and you need anything, shout out.
Yeah. Well, thank you so much for being here and for telling your girls' stories.
Of course.
I always like to close with asking you to describe birth in 3 words.
Oh gosh. A blessing. Difficult and rewarding.
Oh, I love that.
Yeah.
Thank you.
Yeah.
All right. Well,
Thanks for having me.
So happy to have you.
This was fun.
Well, you've been listening to the Arrivals podcast. Until next time.